Hey guys, welcome back to the channel. If you're new here, I'm Yugo Nuta, and today we're diving deep into a health topic that affects over 500 million people worldwide: diabetes. Now don't click away. I promise this isn't a boring lecture. In the next few minutes, I'll break down exactly what diabetes is, why it happens, how to spot it early, and what you can actually do to prevent it or manage it better. And stick around till the end because I'll also tell you what we're covering in the next episode. It involves food, fitness, and some natural tips that actually work. Let's jump right in. Again, what is diabetes? Alright, let's start simple. Diabetes, or diabetes mellitus, if you want to sound fancy at a party, is a chronic abetes. That means it sticks around for life. But what's really happening in your body? Here's the deal. When we eat food, our body turns it into glucose, a type of sugar. That sugar goes into our abetes bloodstream and gives us energy. But to get the sugar from the blood into the cells where the energy is actually used, we need a hormone called insulin. Think of insulin like a delivery guy. He picks up the sugar and knocks on the cell's door like, "Hey, got some energy for you." And the cells let it in. In diabetes, this system breaks. Either there's no insulin to deliver the sugar, or the doors don't open. That's called insulin resistance. So the sugar just stays in the blood, and that leads to high blood sugar or hyperglycemia. Not good. The glucose-insulin cycle, let me paint a picture. You eat a burger, or rice, or even a banana. The food breaks into glucose. Blood sugar goes up. Pancreas says, "No problem, I got this." Sends out insulin. Insulin tells cells, "Hey, open up." Cells say, "Cool," and take in the sugar. Energy levels go up, you feel good. That's a healthy system. Now in diabetes, you eat something. Sugar enters the blood. Pancreas either doesn't show up, type 1, or sends insulin, but the cells go, "Who dis? We're not opening." The sugar has nowhere to go, so it builds up in the bloodstream. Too much sugar in the blood is toxic. It can damage your eyes, kidneys, nerves, heart, and that's when real problems start. Types of diabetes. Let's break down the types. No jargon, just clarity. Type 1 diabetes. Your body attacks its own pancreas. No insulin. Mostly shows up in kids and teens. Needs daily insulin injections, no shortcuts. Type 2 diabetes. Your body makes insulin, but your cells are like, no thanks. It's more common, about 90% of cases. Often caused by poor diet, lack of exercise, being overweight, or just bad habits. The silver lining? You can actually reverse it with lifestyle changes. More on that later. Gestational diabetes. Happens in pregnancy. Temporary, but increases future risk of type 2. Needs monitoring for the mom and baby. 4. Causes and risk factors. Okay, what causes diabetes? Sometimes it's genetics. If mom, dad, or grandma had it, you might too. But most often, it's lifestyle. Things like a poor diet full of sugar and processed foods. Not moving your body, like ever. Stress, yep, that plays a role. Sleeping less than 6 hours a night. Being overweight, especially belly fat. Smoking, heavy drinking, and just getting older. Basically, your body's insulin system wears out. But the good news? You can change that. And we'll talk about it. Persistent symptoms. So how do you know if you have diabetes? Here are the classic signs. Thick as sun. And if you have 2 or more of these, don't panic. But go get tested. Going to the bathroom a lot. Always feeling thirsty, like desert-level thirst. Hungry, even after eating. Losing weight without trying, and not in a good way. Blurry vision. Feeling tired all day. Numbness or tingling in your hands and feet. Cuts or wounds that heal really slow. Sometimes people have no symptoms at all. That's the dangerous part. So don't wait for signs. Get tested. Consistent 6. How is it diagnosed? All right, let's talk tests. Test 1. Fasting blood sugar. Take it in the morning before food. When its artices below 100 equals good. 126 or more, it diabetes. Consistent 12. Test 2. HbA1c. Gives your 3-month average sugar level. 1. Below 5.7% equals great. 9. It below above 6.5% equals not great. Consistent 3. OGTT. Oral glucose tolerance test. Drink a sugary drink. Wait 2 hours. Sugar over 200 milligrams per deciliter? Yup, diabetic. These are easy, affordable, and could save your life. So don't delay. Just do it. Treatment and management. There's no permanent cure for diabetes yet. But the good news is, with the right steps, diabetes can be managed, and in many cases, especially with type 2, it can even be reversed. Let's break it down by type. Type 1 diabetes. This is an autoimmune condition. The body can't make insulin anymore, so the treatment focuses on replacing what's missing. You'll need daily insulin injections or a pump to mimic what your pancreas used to do, frequent blood sugar checks to keep levels in a safe range, thoughtful meal planning, especially watching carbs and sugar intake. Regular exercise improves energy, mood, and blood sugar control. Strict routine with medication, no skipping doses ever. It takes effort, but people with type 1 live full, healthy lives with good management. Type 2 diabetes. Here's where it gets exciting. This type can often be reversed or put into remission with lifestyle changes. Here's what you can do. Cut back on refined carbs and sugary snacks. They spike your blood sugar. Move your body daily. Even a 30-minute walk after meals can make a big difference. Lose extra weight, especially around the belly. Take medications if prescribed, like metformin, which helps your body use insulin better. Get enough quality sleep. 7 to 8 hours a night is crucial. Manage stress. Chronic stress can mess with your hormones and sugar levels. And no, you don't need a fancy gym or some expensive celebrity diet plan. Small, consistent habits make a huge difference over time. It's about progress, not perfection. 8. What happens if you ignore diabetes? All right, let's get real for a second. If diabetes is left unmanaged or worse, ignored, it can lead to some serious and life-altering complications. Here's what can happen. Nerve damage, neuropathy, causing tingling, pain, or even numbness in your hands and feet. Vision loss from diabetic retinopathy that can lead to blindness. Kidney failure, requiring dialysis or even a transplant. Foot ulcers and infections, which may lead to amputation if untreated. Heart attacks and strokes because diabetes damages your blood vessels over time. And these complications don't just appear overnight. They build up silently, often without warning. That's why regular health checkups, daily care, and early action aren't just helpful, they're life-saving. 9. Summary. Whew! That was a lot. Let's recap the key takeaways. Diabetes is when your body struggles with blood sugar control. There are 3 types: type 1, type 2, and gestational. Type 2 is most common and often reversible. Watch for symptoms like fatigue, urination, and thirst. Get tested. Early detection matters. And yes, you can live a long, healthy life with diabetes if you take it seriously. Thanks for watching, friends. If you found this video helpful, smash that like button, share it with someone who needs it, and hit subscribe for more life-changing health content. In our next episode, I'll show you the best foods for diabetics, how to build a daily routine, and even natural herbs and spices that help lower blood sugar. All backed by science. Until then, stay informed, stay healthy, and take care of yourself.